Mr. Chairman, I move to strike the last word. After the Health Subcommittee that Mr. Guthrie referred to, where we heard direct testimony from patients and also from the FDA and the NIH, and all agreed that more must be done to improve access to safe and effective treatment, particularly for ALS. Nobody that was in that hearing room could listen to the powerful testimony of Brian Wallach and his wife Sandra from the organization I Am ALS, or any of the other witnesses from the other degenerative diseases, and walk away without considering the challenge that is put in front of us in Congress. Unfortunately, what I see is a partisan gotcha amendment gets us no closer to a cure for ALS and these other severe diseases. And I think that we need to reject this amendment. My Republican colleagues and the pharmaceutical industry would have you believe that only by continuing to charge whatever they want, that we could potentially have future treatments and cures for ALS and other devastating diseases. Under that logic, we have no choice but to force patients to pay whatever the industry demands from those patients. But we know the arguments don't hold water, because patients are paying for a lot more than research and development when they fill their prescriptions. For example, the House Oversight Committee research found that the leading drug companies have spent more on stock buybacks, dividends to investors, and executive compensation than on research and development. That same report found that the drug companies could maintain or even exceed the current R&D expenditures and any kind of reducing of revenue from that if they reduce the spending on buybacks and dividends. And so today we are living in a world that even under the current drug pricing framework, in which drug companies can charge whatever they want and rake in every kind of profit that they want and keep needed competition at bay, we still lack good treatment for diseases like ALS. Instead of turning toward cynicism like the amendment that has been offered, the Build Back Better plan will move forward toward treatments and cures for ALS and other diseases like it by investing $3 billion toward the advanced research project, the advanced research projects that are available. I also just wanted to mention that one of the major things that the patients were asking for in this very emotional hearing was that these patients, especially Mr. Wallach, is dying, and he wanted to get access to experimental drugs. But what we just learned today is that Amylyx announced that they are planning to apply for FDA approval of this drug for ALS, an ALS treatment, and we just need to ensure that this is going to be affordable. People are dying and waiting, and we're saying that these companies can charge whatever they want. I'm sorry. We should reject this amendment. I yield back.
Thank the gentlewoman.